My name is Dr. Greg Hayes. I'm a vascular surgeon at Swedish Medical Center. I'm the chief of vascular surgery and also the medical director of Swedish Medical Group. Vascular surgery is unique in that we care for many of the systems in the body. So we treat patients who are at risk for stroke. We treat patients who have aneurysms and are at risk that they may rupture and potentially threaten their lives. We also treat patients who have poor circulation to their limbs. So we salvage their limbs so they can go on living a good quality of life. And also support patients who are on dialysis. We provide them with access so they can undergo their dialysis treatments. Well, vascular surgery, like all aspects of our lives, has undergone a great deal of technological advancement. And since the time that I trained, much of what we do, like other specialties in surgery, has moved into a minimally invasive approach. So in the past, when we may have had, for instance, an aneurysm operation that may have taken 4 or 5 hours to do, with a patient being in the intensive care unit for several days and in the hospital for several days, we can now do that procedure in 2 to 3 hours, minimal blood loss. The patient doesn't go to the ICU and they're often home the next day. We have an excellent group of physicians and surgeons here at Swedish Heart and Vascular Institute, of which vascular surgery is part of. We have an excellent collaborative relationship amongst all the specialists. We offer current, modern-day, cutting-edge treatment for the patients, and we have excellent outcomes. When I see a patient for the first time, I think the most important thing is to establish a relationship with them so that I can understand their lives and they can understand what their vascular disease entails and what treatments are available to them, so that when we make a decision in terms of their treatment, that it's a shared decision between myself, the patient, and their family members. And I'm here to counsel them. I'm not here to make the decision for them. I'm here to give them advice so that they can make an educated decision with regard to what treatment is best for them.